everyone. I'm Ruba Bayram, a first-year medical student and a member of PACademia. Today I'll be discussing distribution of the drugs, explaining specifically binding of the drugs to the plasma proteins as well as volume of distribution. So as we know, the drugs are going to be binding to the albumin in order to be transported. Okay, in order to be transported. The degree of which the drug is going to be binding to the albumin is called as the affinity. So some drugs are going to be having higher affinity, meaning that they're going to be attaching to the drug strongly, while others are not going to be as strongly attached to the albumin. So each drug, they're going to be having specific affinity. Some of them are going to be very attached to the albumin, while others are not. Here it mentions a reversible binding. As we can see from this picture, that the drug can be in two forms. It can be in the free form and the bound form. So here, for example, I have my albumin and I have these drug molecules, and I have also free drugs that are not attached. When this drug, for example, leaves and it starts to detach and starts to get liberated from the albumin, okay, it becomes a free drug. And then this leaves and the other one will start to take its place. Okay, so as we can see here, we have a free drug becoming a bound drug. This is this step, right? This is this step, a free to a bound one. And then also, this is one. And then also I have my bound drug becoming a free drug. This is my bound drug and it's becoming a free drug. So this is number 2. So this is the idea of reversibility. Or the reversible binding, is that the drug will be existing in both forms, a free form and a bound form. It will continuously be in an equilibrium, okay? It will continuously be in an equilibrium. As we can see from this picture, we can see that we have free drugs as well as bound drugs. One thing we need to understand here is that the free drug is the only one that can leave and go to the tissue to do its effect. So the only form of the drug that can do the effect, that can do what it's supposed to do, what the drug is supposed to do, is the free drug. The bound drug cannot, because it's attached to the albumin, cannot be detached to do its job. So binding of the drug depends on drug affinity. These are anticards that I have made. These are already uploaded actually on the sheet. I highly recommend you guys to use them, because they're going to be questions or made based on the lectures that we have, and they're going to be helping you test your understanding as well as memory, okay? So they're going to be put here. So here I wrote, binding to the albumin depends on drug affinity. As I mentioned, some drugs will have higher affinity, some of them will have lower affinity. But basically, what is affinity? Degree to which the substance is going to be attached. So how attached is it? It's going to be very attached, medium, low, that kind of thing. Again, the drugs should be easily liberated. They should be easily detached. Why? For better drug effect. Why is that? Because as you mentioned, the only form of the drug that can have a drug effect that does its job is the free drug. And when it's liberated from the albumin, it becomes a free drug. Okay? But if it's going to be stuck, it's a bound albumin. Okay? So that explains it. Now, volume of distribution, this is a definition. Okay? Learn it. Now, this is very important. This formula, if you learn it, and it's not learning it for calculation-based purposes, but it's for the understanding of the concept. If you learn this formula, you will understand the whole concept that we're going to be explaining. So here, what you need to understand is that if the VD increases, this means that the distribution of the drugs is high. So if I have a lot of the drugs is going to be distributed, the VD will be high or increases. And automatically the drug in the blood is going to be below, because all of the drug is distributed, less amount of the drug is going to be in the blood. Okay, so this formula, VD equals amount of drug in the blood, in the body. So basically drug in tissues, let's say, to simplify it, over the amount of the drug in the what? Blood. Okay, so here we can see that VD is going to be directly proportional to the drug in the tissues. What does it mean directly proportional? It means if the concentration of the drug in the tissue increases, the VD will increase. The VD will increase. And the VD is also inversely proportional to drug in blood. Meaning, If the drug in the blood is more, or most of the drug is in the blood, the VD will decrease. This is very self-explanatory. We have taken it from the formula. Let's say VD is going to be over 1 because obviously there's nothing, the VD is not divided over anything. And as we mentioned, it's going to be drug in blood, in tissues, over drug in blood. Okay? If drug in tissues increases, VD increases automatically. Why? Numerator, numerator. They have the same effect, directly proportional. But if the drug in the blood will increase, what happens to the VD? It will decrease. Why? Numerator, denominator. They're inversely proportional. Okay, they're inversely proportional. The numerator and numerator, same effect. This increases, this also increases. But if it's a numerator and a denominator, what happens? If this increases, this will decrease. It's inversely proportional. Learn this, understand it, you will understand everything. Now, based on this, what I explained, you can understand the whole thing that is going to be written here. Drugs is restricted to the vascular compartment, meaning the drugs are mostly in the blood. Let's look at the equation that we have just learned. If the drugs is going to be mostly in the blood, this means this increases. Yes? If this increases, what happens to the VD? Decreases. Inversely proportional. Numerator, denominator. Right? So as we can see here, VD is low. Okay? What are the drugs that have a VD that is low? Is going to be large and charged molecules. Obviously, large and charged molecules are going to be unable to be distributed. They can't pass through the membrane. They're charged. They're not lipophilic. They're very large. So that's self-explanatory. Example of it is the warfarin, and they're very protein bound. So they're bound to the albumin mostly. Warfarin is an example. As we know, the warfarin is going to be an anticoagulant, so we want it to be in the blood. So having a low VD doesn't mean it's a bad thing. Some drugs we want it to stay within the blood, and an example of that is the warfarin. So the manufacturers, based on this concept that they understood, for example, if they said, I want to make the drug that is going to be affecting only the blood. So now they know, okay, if I want it to stay mostly in the blood, this means it needs to be a low VD. How does it make it a low VD? Making the drug large, charged, all of that, okay? Now the opposite is also true. If the drug is accumulating in the tissue, so here the tissue and the drug in the tissue is more. This means the VD will increase. Numerator, numerator, directly proportional. If this increases, this will increase. If this decreases, this will decrease. The same effect, okay? So as we can see here, it accumulates, so it's high, so VD will increase. See? VD increases. VD increases. What are the type of drugs that are going to be having a high VD? These are the small and lipophilic. The opposite of why this happens. They're small, lipophilic, they can penetrate through and get inside the tissue and get distributed to different compartments, okay? I understood now the concept. We will see that this concept will help us understand the clinical implications. First, highly PP drugs are largely restricted to the vascular compartment and tend to have lower VD. We understood this. Highly PPV means the plasma protein binding. This drug is very bound, highly. So it's going to be having a high affinity. So it's bound to the albumin very strongly. This means it's going to be mostly in the blood, because this is, for example, my albumin, and I have this drug, and it cannot leave to get liberated because it's so stuck to this albumin, it's very hard to get detached. So most of it is going to be, in the vascular compartment. It will be taking a lot of time for it to be released as a free drug into the tissue, okay? So this means that it's mostly in the vascular, and because it's mostly in the blood, as we can see from the formula, if it's mostly in the blood, the VD will automatically decrease. What? The numerator, denominator, inversely proportional, all of this we talked about. So lower VD. This idea is not available for action, as we know. The idea is that the free drug is the only one that's doing the effect. Here you can see free drugs are the ones causing the effect and not the ones that are going to be bound to the albumin. Okay. So here this is the antivirus that I made as well. Again, you can see the higher the drug affinity, so the more it's going to be stuck, the higher its concentration in the blood. So if it's stuck mostly in the on the albumin, most of it is going to be in the blood and not going to go to the tissue. They're not going to go to the tissue. No, they're going to be stuck on the albumin, so most of it will be in the blood. If most of it in the blood, this means the VD will decrease, lower VD, okay? Now, drug-drug interactions. For example, in patients who take multiple drugs at the same time, like hypertensive, diabetic people, right? They take a lot of drugs at the same time, they need to. So there's a drug-drug interaction. As I mentioned, different drugs having different affinities. Let's say this drug is going to be having a higher affinity than the other. What does that mean? This means that the drug with the higher affinity will be the one that's attaching to the albumin. This is kind of like a competition. Okay, it's a competition. Drug A and drug B are competing to who can bind to the albumin more. If drug A has a higher affinity, which in this case it does, it has higher affinity, so this means this is the one that's going to be attaching to the albumin. It has stronger ability or degree to attach. Okay? This means that this, as we can see, most of the A is bound and B is mostly as free drug. Okay? Now, there can be a problem in this instance. For example, in this example, I have aspirin and warfarin. Aspirin is the one that has high affinity, so it's mostly bound to the albumin. And so warfarin, if it can be bound to the albumin because of A, it's going to be in the free drug form. If it's in the free drug form, it can cause hemorrhage to the people. As we can see, it's going to be a free drug. Toxicity will increase. The patient will suffer from hemorrhage because warfarin is an anticoagulant. And as we mentioned, warfarin is a free drug, yes. It doesn't have to go to the tissue because it works in the blood. Its job is to work in the blood, okay? So it will start to cause hemorrhage in these patients. It prevents coagulation, basically, okay? Now, hypoalbuminemia. Okay, plasma concentration of the drug referred to bound as well as free drug. As we can see from this diagram, there's free drug as well as the albumin bound. They're all in the blood. This is my blood vessels, right? So let's understand. Hypoalbuminemia. Hypoalbuminemia means what? It means less albumin. I have less albumin. If I have less albumin, what happens? For example, these are the albumins, and I have, it only has the ability, each albumin has, say, the ability to bind to 2 drug molecules. This is an example. This is theoretical. This is not true. I'm giving an example, okay? And so I have very low amount, and so most of the drugs are now going to be in the free form, right? Most of the drug is now going to be in the free form, right? As we can see, we have more free drugs. So most of the drugs are now going to be free because I have low amount of albumin. If I had a normal person with normal amount of albumin, right, now most of the drug will be attached to the albumin. Most of the drug will be attached to the albumin, and less is going to be as free drug, right? But in this case, I have low amount of albumin, so most of it is going to be as free drug because there's no more, or there's no enough albumin to attach. So if it's not attached, what it will be? Free. So because I have free drug now, it will be free drug, it can be distributed. So most of it will be distributed. Again, we can see here, hypoalbuminemia means what? Less albumin, yeah? And this means reduced binding. As we can see, less is going to be binding, and most of it is high free concentration, free drug concentration. As you can see, there is more concentration of the free drug. Here we can see from this diagram. And hence we have high VD because then the free drug can then move and get distributed in the tissues. If I have more distribution to the tissues and other compartments, extracellular fluid, all of this, this means that the VD will increase from this here, right? If the body tissues will increase, the VD will increase numerator, okay? Directly proportional. This is what it means. So as we can see, this is the whole concept. I hope you guys have understood. If you guys have any questions, feel free to write them down in the comments. And I hope that I have cleared some of the doubts that you guys had. Thank you.